More local news now. As a result of the curfew that was imposed in Sri Lanka, the human activities across the island has been limited, and therefore as a result of that, Sri Lanka's quality levels of air and water has also improved.
According to data provided by the Air Quality Monitor at the US Embassy, Colombo's air quality levels stood at 50 as per 5 p.m. today. This means it has a moderate rating. HDS Premasiri, a senior scientist at the National Building Research Organization, told Newsfirst that the air quality has improved due to the reduction in the movement of vehicles as a result of the curfew. He recalled that air pollution levels were much higher prior to the imposition of curfew. The country's air quality levels plummeted in November last year, caused due to smog in neighboring India, posing a risk to sensitive groups. The Central Environmental Authority said the quality of the water in the Kalani River had improved due to a drop in industrial effluents being released into the waterways. The CEA in a statement observed that the turbidity levels of water in the 145-kilometer-long Kalani River, which cuts across 5 districts, has remained positive, unlike any other period in the recent past.
We will now direct your attention to the current situation pertaining to COVID-19 here at home. Now, 3 new COVID-19 patients were identified from the country today, and 8 people were tested positive for the virus yesterday. This brought the total number of confirmed COVID-19 cases in the country up to 162. On a positive note, 27 people have completely recovered from the COVID-19 virus, and the total number of COVID-19 related deaths in the country currently stands at 5.
The Ministry of Health reports that 131 COVID-19 patients are receiving treatment at hospitals. 273 people suspected to have contracted the virus are under observation. The 5th casualty of COVID-19 was reported this morning from the Valikanda Base Hospital. This was the first COVID-19 related death that was reported from the Valikanda Base Hospital. According to our correspondent, 5 Grama Niladhari divisions in Beruwala, including Pannila, have been placed under isolation after a person tested positive in the area for COVID-19 recently. Meanwhile, certain villages are still under isolation due to the spread of the coronavirus. The villages under isolation are Telambugahawatta in Akurana in the Kandy district, the Atulugama village in the Kalutara district, Kadumayan Kulam in the Putlam district, and Thavid in the Jaffna district.
The patient who died yesterday was around 43 years old. He had arrived from Italy. He displayed symptoms of the virus when he arrived in the island. He was then sent to a quarantine center. Thereafter, he was admitted to the Valikanda hospital in Polonnaruwa. He passed away while receiving treatment at the hospital's ICU. The deceased did not suffer any other health complications, such as high blood sugar or diabetes. This clearly shows the severity of this virus. From what we understand, there is no age barrier to contract the virus. Those who already suffer with other health complications are not the only ones who can be affected by COVID-19. What's important now is to work together to curb the spread of the virus.
I'm sure all of our viewers would agree that we are currently living in a very uncertain time, and with such times come the spread of false news, and authorities have been trying very hard to tackle this particular issue. Accordingly, the Sri Lanka police says rumours of a total shutdown of Sri Lanka from the 10th to the 15th of April, which is currently making the rounds especially on social media, are false. Police media spokesperson SP Jalya Senaratne issued a media release today in response to fake news which has been circulating, claiming a total shutdown of the country, including essential services, between the 10th and 15th of April will occur. SP Jalya Senaratne said the general public should not be deceived by such false statements and stressed that such false social media posts must not be shared. He added the Criminal Investigations Department will launch an investigation into those who create such false content and those who share false content on social media platforms. A public health inspector who was on duty in the Pattampiti area in Rambukkana has been attacked with a sharp weapon. The PHI was on duty at the time of the incident as part of the effort to curb the spread of COVID-19. Police said he is currently receiving treatment at the Rambukana hospital for the injuries that he suffered. Police are on the lookout for the suspect, identified as a 15-year-old boy residing in the area who had fled following the incident. Now, the Government Medical Officers Association has been very vociferous during the time of the COVID-19 outbreak, and as such, the media spokesperson of the GMOA, Dr. Samantha Ananda, expressed these views regarding COVID-19 in the country. In addition to the people who have returned from overseas and those who have associated the returnees and other members of the community are also among those infected by the virus. This is a serious situation. We need to prevent this. We clearly stated that even the World Health Organization has recommended aggressive testing. This means that everyone should be tested as much as possible, and these tests should be conducted repeatedly. The Ministry of Health tells us that they can conduct between 750 to 1,000 tests per day. But unfortunately, they are only conducting 250 tests or even less than that. We don't understand why this is the case. By Monday, if our testing capacity is not increased, we as the Government Medical Officers Association will take the necessary measures to protect the general public. We cannot stand by and watch this happen. We should implement aggressive testing in the country. By doing this, we can both identify new patients and prevent the spread of the virus. The best example for the advantage of conducting aggressive testing was seen on the 31st of March. On that day, 20 people were tested and 10 of them tested positive. Both who displayed symptoms of the virus as well as those who did not were tested on that day. This clearly shows us that an increase in the number of testing, including conducting tests on people who do not show symptoms of the infection, can help us identify more patients.
Meanwhile, the testing of samples to identify COVID-19 patients commenced at the Jaffna Teaching Hospital today.
Now, health authorities here at home as well as authorities from the WHO or the World Health Organization have confirmed that testing potential patients who have been infected with COVID-19 is the most effective way to curb the spread of the COVID-19 virus. Accordingly, the government has decided to repeat tests on individuals who have suspected to have contracted COVID-19 and those who had come into contact with any such persons. Now, this was revealed at a progress review meeting at the nationwide program to curb the spread of COVID-19, and this was chaired by President Gotabaya Rajapaksa.
The meeting, held at the Presidential Secretariat, was attended by medical officers, the Commander of the Army, and members of the security forces. A communique issued by the Presidential Secretariat stated the government will continue to take decisions as it did before to combat the COVID-19 outbreak in the country based on the recommendations of professionals and specialists in the fields of medicine, security and law. At the meeting, it was decided to closely observe the spread of the virus across the globe and implement the recommendations made by the World Health Organization. It was agreed that the program launched by the government to combat COVID-19 will continue until the situation in the country takes a turn for the better. Speaking at the meeting, the chairman of the Government Medical Officers Association, Dr. Anuruddha Padeniya, said that the outbreak in the country was managed to a certain extent because of the swift measures that were implemented by the government. However, he added that the threat has not yet passed.
Now, authorities have taken steps to direct many people who were here in the country as well as many people who arrived from overseas. They have been directed to quarantine centers situated across the island. Now, a group of 280 people who completed the particular quarantine process returned to their relevant residences today. The army said that these people had undergone quarantine in the Katukeliava, Kandakadu and Iranamadu quarantine centers.
108 people who completed the quarantine process at the quarantine centres in the Sri Lanka Light Infantry Camp in Katukeliava, Minneria Polonnaruwa left for their homes today. They had returned to the country from India on the 20th of March. No one has to worry about this. We remained under quarantine for a period of 14 days and we were treated very well. No one should be afraid of the quarantine process. They treated us even better than our families do. We thank President Rajapaksa and the army for all the support. 7 students who returned from India were among the group who returned to their homes today.
Another 598 Sri Lankans are stuck overseas, unable to return to the island. We returned prior to the imposition of the lockdown restrictions. I urge everyone to look into this matter as well. We thank the army for all the support.
They were residents of Colombo, Kandy, Dambulla, Mathura and Kurunegala. The Sri Lanka Air Force said that 172 people left the quarantine centre at the Iranamadu Air Force camp today. Meanwhile, 5 people who returned from India recently received their self-quarantine discharge certificate.
Currently, there is an island-wide curfew that is in effect and 242 people have been arrested for violating curfew between 6 a.m. and 12 noon today.
83 vehicles have been seized by the police during this time period. A total of 12,465 people have been arrested for violating curfew since it was imposed on the 20th of March. In addition, 3,100 vehicles have been seized during this period. Police curfew continues to be in effect across all districts in the island. Curfew in the Colombo, Gampaha, Kalutara, Puttalam, Kandy and Jaffna districts will continue to be in effect until further notice. Curfew in the remaining 19 districts will be lifted at 6 a.m. on the 6th of this month.
Meanwhile, 203 people who violated curfew in the Anuradhapura district were arrested today. Police said that these arrests had been made between last night and this afternoon. 35 motorcycles and a luxury vehicle have been impounded. A person who had transported dry rations using a banner containing the state symbol and the Sathosa logo had been arrested in the Talava area in Anuradhapura. Our correspondent said that the suspect had been transporting goods to shops in the area. A person who had engaged in an illicit liquor racket during curfew was arrested in Hungama. Police said that 30 litres of liquor, a barrel and a locally manufactured revolver used to fire T-56 rounds of ammunition were recovered from the suspect. The suspect has been identified as a 30-year-old resident of the same area. Meanwhile, police took measures to shut down shops and evict hawkers who were selling vegetables during curfew along the Kandy Road. 3 suspects who violated curfew have been taken into custody.
Now, many services in